Hello everyone. This presentation is on Gui Zhi Ling Wan, also called cinnamon twig and poria pill. It appears on the California Acupuncture Board examination herbal formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Gui Zhi Ling Wan is classified under invigorate the blood. A representative pattern is blood stasis in the lower abdomen with fixed masses, or menstrual pain. Important ingredients include Gui Zhi, Fu Ling, Mudan Pai, Tao Ren, Bai Shao. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 44-year-old woman with fibroids and heavy periods. The current medicines are apixaban, metformin, ibuprofen as needed. This case gives a plausible reason to consider Gui Zhi Ling Wan, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Tao Ren plus apixaban. The mechanism is peach kernel has antiplatelet and blood invigorating activity that may add to anticoagulation. The clinical significance is moderate to high in a patient with heavy menstrual bleeding. My management plan is avoid or use only with prescriber agreement and monitor bleeding. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Mudan Pai plus antithrombotics. The mechanism is Mountain has antiplatelet signals in experimental data. The clinical significance is potentially additive. My management plan is avoid stacking with NSAIDs and monitor bleeding. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Gui Zhi plus metformin. The mechanism is cinnamon-related compounds may lower glucose. The clinical significance is low to moderate. My management plan is monitor glucose during initiation. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Gui Zhi Ling Wan may be reasonable when the patient's presentation matches blood stasis in the lower abdomen with fixed masses or menstrual pain. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board examination formula list, standard Chinese herbal formula texts such as Bensky and colleagues, Chen and Chen's pharmacology and applications text, and evidence-based drug and herb interaction resources. Thank you.